안녕하십니까. 마스터 코스 중 다양한 임플란트 서저리 키트에 대해서 설명을 할 네오치과 최호철입니다.
Greetings, this is a master course on various implant surgical kits, and I am Dr. Ho-cheol Che, Neo Dental Clinic. First, I'm going to briefly talk about how to maintain implant surgical kits, and we'll talk about these implant kits in the list. Implant surgical kit. Implant surgical kits need to be maintained, which is very important. During surgery, you need to remove the blood clots and you need to sterilize the implant instruments used. After surgery, you need to sterilize the instruments with alcohol first, and you need to wash it with distilled water or running water, and you need to dry it with a cloth or hot air blower. Next, sterilization. You need to sterilize them in advance so that they can be used. Next, an autoclave. The wet method is usually used for 15 minutes at 132 degrees. Today, many dentists use ion gas or plasma gas for sterilization. Regular placement kit. There are two types. Taper body type implant placement kit and straight body type implant placement kit. Taper body type has the taper kit and a 1 to 2 taper kit. Straight body type has 1 to 3 straight kit and new Hanaro kit. First, the taper kit. Taper kit is used to place implants in five-step drilling. Taper kit. It has 5-step drilling. First, lens drill is used, followed by 2.2 mm twist drill, and then f3.5, f4.0, f5.0, and f5.0 cortical drill are used to place an implant of 5-step drilling. What is important is the shapes of the taper drills. Actually, when we place a 10 mm implant, f3.5, the total drilling depth is 11.7 millimeters. To place 5.0 mm diameter implant, f5.0 drill is used, and the drilling depth would be 12 millimeters. When you place an implant in the mandible, inferior alveolar nerve runs. Therefore, to place a 10 millimeter implant, the distance from the crestal bone to the inferior alveolar nerve needs to be 13.5 to 14 millimeters, including the minimal safety zone, and you need to remember this to perform surgery without damaging the inferior alveolar nerve. 1 to 2 taper kit. 1 to 2 taper kit is different from general kits. Taper kit has 5-step drilling to place an implant, whereas 1 to 2 taper kit omits these steps and the drilling is simplified and minimized to place an implant. So it is a simplified kit. Lace cutting power and shapes are different between these two kits. Next, 1 to 3 straight kit. There are 3 types of kits. The first one, 1 to 3 straight simple kit, is using a stopper. That is the kit with a stopper. And 1 to 3 straight kit has various drills without using a stopper. 1, 2, 3 straight full kit is to place ultra wide or short implants. 1, 2, 3 straight kit. If you look at the features, side cut drill, F3.5 twist drill is used, followed by 4.5 or 4.5 cortical drills are used to place an implant. So this is a 3-step drilling kit. New Hanaro kit is an improvement over Hanaro kit. Hanaro kit features a straight drill to place 2 and 3 body type implants. Hanaro kit is used to place a straight type implant. Straight implant can be placed with this, and also, as you can see, tapered type implants can also be placed with this kit. Let me talk about special implant placement kit. First, MS kit. MS implants, as you know, are placed in the interior region where the space is narrow in the mandible. The diameters of MS implants are 2.5 and 3.0 millimeters, so smaller diameter drills are used. In MS implants and abutments are connected, so a special wrench is included in the MS kit to place the implants. Next, the 485 kit. The 485 kit is used, as you can see, when the distance to the inferior alveolar nerve is short, to place a 4.0 to 8.5 millimeter implants. Before we had this kit, we used to use casket with a stopper. This is a special drill designed for this specific clinical situation. Ultra kit, as you can see, it is used to place an implant immediately after extraction in the extraction socket, and it is used to place ultra-wide implants in a wide bone. So this is specially designed for this case. Additional surgical kit. Additional surgical kits, maxillary sinus lifting kit, bone graft kit, ridge split, and expansion kit. Maxillary sinus kit, CAS kit, LAS kit, Osstem kit, provided by Osstem, bone graft kit, GBR and Os builder kits, ridge split and expansion kit, asset kit, bone spreader kit, and ridge split kit. First, the CAS kit, which is widely known. CAS kit, when we lift sinus, there are 2 approaches: lifting through the socket or making a window to do bone augmentation. The casket is useful when we do the bone augmentation through crestal approach. Casket can be used in the inclined sinus or flat sinus, and when there is a septum, it can be used without tearing the sinus membrane. This is a verified kit. LAS kit. When we use a lateral approach, this can be quite useful. This kit is very useful because we don't have to make a big window to approach. The way to use it is we raise a flap and use a dome or cord drill to do the lateral approach. And then sinus membrane is lifted and bone is augmented to place an implant. So it is quite useful for that purpose. GBR kit. GBR kit. When we augment bone, we can use membrane or titanium mesh or block bone. All of these can be fixed, secured, and the membrane is secured. This kit can be used. Kit type, screw type, and mesh can be secured with the screws. All the anchorage can be accommodated, and this is quite useful for bone augmentation. Os Builder kit, 3D type customized titanium membrane is formed, and a vertical contoured bone augmentation can be facilitated with this kit. Asset kit, which I use quite often. It is to split a narrow ridge. It is used for more maxillary expansion than mandible. First, the wheel in the asset kit is used to separate the ridge. It is a taper type, screw type expansion instrument. It is a very useful instrument rotated at low speed to expand the ridge and place an implant. Guide placement kit, positioning guide kit. Without using a surgical stent, we can place implants in optimal positions. So good positions can be secured with this. Maintenance kit. Maintenance kit. There's ESR and EFR kits. When an implant is used for a long time, excessive occlusal force, or for other reasons, threads of implants can be fractured like this. In the past, we couldn't remove these, and in the worst case, we had to remove the implant. But Osstem's ESR kit, the fractured screws can be removed without harming the implant. So they can be completely removed easily. Compared to other companies' removal kit, there's a handle on the wrench, so the fractured screws can be easily removed. Lastly, EFR kit. When implants are used, the top portion can be torn and implants can fail due to peri-implantitis. In the past, a surgical or trephine burr was used to remove the surrounding bone, but now EFR kit can be used to remove the fractured implant easily. We talked about implant surgical kits. If you want more details, the offline master courses are recommended. This concludes the lecture. Thank you very much for your attention.